Based on the evaluation for patients, we recommend male sling to allow him regain control of urination. It is effective, minimum invasive way of treating stress urinary incontinence. So if you choose to use the male sling or to be elected for a sling, I think you should see a specialist who can do a very thorough evaluation, as well as providing you this the latest techniques and treatment for this problem. During the procedure, you'll be asleep under general anesthesia. You'll be placed in a supine position with your legs lifted up in a lithotomy position. That will allow me to expose the skin and place the sling around the urethra. After the male sling procedure, you can go home. We call it outpatient procedure. For those who wants to stay in the hospital for 23-hour observation, that's also a possibility, an option for them. Like any other procedure, I think going for surgery, I think you're going to be seen by the preoperative team, assessing your risks and your medical history to ensure that you are ready for the anesthesia and ready for the procedure. If you're receiving general anesthesia, I think you should be securing transportation as well as accompanying an adult member of your family to take you home. That is important to secure before procedure. So my nurse will provide you with the written as well as verbal instructions how to care for your skin before the procedure, which include skin wash with chlorhexidine, taking shower before the procedure, and taking essential skin preparation, and when to fast and when to arrive. All this will be written on a piece of paper that will be handed to you when you see us in the clinic. If you're taking medication that interfere with surgery, such as blood thinners, that's recommended to stop it safely, and if it's okay to do so by your cardiologist or by your primary care doctor. But otherwise, for the most medication, it is okay to continue it up to the day of surgery. If you're receiving general anesthesia, I think our recommendation is to fast from 6 to 8 hours prior to receiving the anesthesia, and that again be reviewed and detailed at the time when you see the preoperative anesthesia team in the hospital. Backlightly, if you're doing an outpatient procedure, you can have your own favorite food or a favorite piece of clothing, especially also if you are staying overnight, maybe pack a little bit for the one night stay. But generally speaking, we have everything we need in the hospital here, so we don't need to bring major stuff from home. You don't have to shave. We are going to trim the hair or pubic hair around the area where we're going to work at in the pubic region right before surgery. So again, you don't have to shave or trim your pubic hair. You'll be received by the preoperative team. You'll be guided and escorted to the area where you're going to meet with anesthesia and other members of the team. You are going to receive a band, a label with your ID. You're also going to receive intravenous cannula, will allow us to introduce intravenous medications. And from there, you'll be taken to the operative suite where we can perform the procedure. My advice for you, if you are nervous about the day of procedure, be accompanied by a trusted member of your family or friend. You can always talk to the anesthesia doctors to give you some medication to help you relax right before surgery. If you have any questions, you can always call my nurse or my team in the hospital during the working hours. Beyond working hours, you can always call the emergency line in the hospital, and we can always be available to you.